Is Canada not telling the public to wear masks because we're worried about a shortage and we want to make sure that doctors and other frontline people have them?
I think there's two separate reasons. I think for sure, absolutely, we want to protect our frontline healthcare workers, and prioritizing supply in that setting is critically important. And we're looking at all sorts of different avenues to procure. For the public, I think the current scientific evidence we are continuing to evaluate. Of course, we can be flexible if we find any new evidence. But I think the scientific evidence is that if you are sick, then put on a mask to prevent those droplets from flying, in any space as you're perhaps going to a clinic or having to move yourself around the community for essential needs. Putting a mask on a asymptomatic person is not beneficial, obviously, if you're not infected. If you're a close contact of a case, and under certain circumstances, especially, you'll also be in self-isolation, by the way, if you're a close contact of a case. And you also need to move for any essential reason. That's perhaps another situation. What we worry about is actually the potential negative aspects of wearing masks, where people are not protecting their eyes or other aspects of where the virus could enter your body, and that gives you a false sense of confidence. But also, it increases the touching of your face. If you think about it, if you got a mask around your face, sometimes you can't help it because you're just touching parts of your face. The other thing is the outside of the mask could be contaminated as well. So the key is hand washing, absolutely, for sure. It doesn't matter what you're doing, hand washing is really key. When you're removing a mask, in numerous infectious diseases, even in the hospital setting, we find that it's removing personal protective equipment that can actually lead to infections. So if people try to use these measures, they have to be really, really careful and wash their hands. Absolutely, that's the key. So we're also worried about the negative, potentially negative impacts.
Goes on, we can expect to get more accurate testing. So you've said right now that about, I think 93 was the number today, of people who've been tested have been deemed to be negative. They don't have coronavirus. Are you concerned about the accuracy of the testing as it currently stands? And can you tell us, when you get tested, what is the accuracy level? Is there a number there that we can know?
So the tests available at the present time are what we call real-time PCR. And they have been validated. The labs that can actually confirm a case have been validated by the National Microbiology Lab or by their provincial labs, which were previously quality assured by the National Microbiology Lab. So these tests are highly performing. But of course, when you're taking a swab of someone, and sending it to the lab, etc. There's multiple components. One is that you got to test the right person at the right time. So if you test someone too early, you may actually not get a positive sample. You may have to retest. How the methodology, how well you swab that sample might come into play as well. So there's clinical judgment in whether maybe someone needs to be retested if they were negative in the first place. So it depends on the circumstances.